Okay, so we're going to be talking about the lower extremity today and just a brief review on the exam, which will be next week. Most of the exam is pure identification. It'll point to a muscle, you identify it. If there's a muscle that may require a specific division to it, be specific. You know, if it's the deltoid, is it the anterior deltoid, middle deltoid, or posterior deltoid? Is it the upper trap, middle trap, or lower trap? Be specific, right? You're not going to be deducted for being thorough. Think of it that way. In terms of action, there may be 7 to 8 questions based on action. What I mean by that is if there's a muscle like Palmaris longus, and it's asking for you to identify the muscle, you would write Palmaris longus. If you see that again on the next image, on the next question, and it says, what is the action? You can't just write flexion and get full credit. But if you write wrist flexion, you've earned full credit. Remember, always put the joint first and then the action. Otherwise, you're writing too much. Otherwise, you're writing flexion of the wrist when you could just write 2 words, wrist flexion. Today, we'll start off with some muscles of the lower extremity. And one that we'll probably start off with is the Iliopsoas. And when I do, if I were to ask that on a test, and it's not asking to name the muscle, but it is asking to identify the action, rather than write flexion of the hip, you can write hip flexion. Pretty straightforward, okay? Always put the joint or the bone, and then put the action, okay? All right, so I'll do a screen share in just a second. Let me get to the right place for us. Okay. All right, let me do a screen share now. Okay, so when you get into the course, you'll click on course materials on the left. You will open up exam 3 info. What you'll see below that, by the way, it's been here for a while. It's been the Vitruvian Man instructions and the Vitruvian Man spreadsheet, the Vitruvian Man data, all that stuff is here. And you can start that. If you've started it already, fantastic. If you haven't, the video instructions are here, as well as the spreadsheet, the data, all the instructions. You will be possibly rewarded up to 21 points. You will get 21 points. I know students ask, can you attach it to the second exam, the third exam? It really makes no difference. When you add 21 points to an exam, it makes no difference whether you add it to your highest exam, the lowest exam, the middle exam, makes no difference. The points will count. Most students earn somewhere between 18 and 21 points on average, somewhere between 18 and 21. I typically don't see anything under 18 points. So all the information is there. When you click on the folder that says exam 3 info, and you move down a little bit today, we're going to be clicking on the link that says lower extremity leg model labeled, not labeled. Okay. When we click on that link, we'll get to this right here. So we're going to move, I may move back and forth between some of these images, but we'll start here on the top left, and which is the anterior. Then we'll probably go to the lateral view, and then we'll go to the posterior view, and then we'll start looking a little bit deeper to each. So if you look on the top left, it's starting with the superficial view of the entire leg. Then we start to dissect away on the upper thigh. Then we look at the lower leg and see what's there. Then we start up here on the lateral thigh. Then we start to dissect a little bit deeper so we can see what's deep on the lateral thigh or hip, I should say hip. And then we'll look at the lower leg from the lateral view. Then we'll look here on the posterior view of the hip, thigh, and leg. And then we'll start to peel things away and see what we have a little bit deeper. Then we'll look at the inner, more medial part of the thigh. We'll see some of the deeper structures of the lateral and lateral hip and posterior thigh. And then we'll finish up with the deepest structure on the lower leg. Okay. And this is being recorded, so we will post this in Blackboard when we're finished. And when I stop the recording, I'll handle any questions if there are any questions, okay? All right, so let's start from the front and let's look at what we have here. So now when we're looking at this region and whatever's happening here at this joint, which is between the femur and the acetabulum, we typically refer to this as the hip. So when the thigh or the femur is moving, we could say hip flexion, hip extension, hip abduction, hip adduction, hip internal and external rotation. We could say thigh flexion, femur extension. So hip is usually the terminology that's used most frequently to describe what the femur or your thigh is doing. So way up here at the top, here's the iliac crest. Here's the anterior superior iliac spine. Here's the pubic bone and the pubic tubercle. This ligament right here is the inguinal ligament. It goes from the ASIS to the pubic tubercle. Above it, we'll see two different muscles. We'll see the iliacus, which originates on the iliac fossa of the ilium. And then we'll see the psoas major, which originates on the lumbar vertebrae, as well as the intervertebral discs. This muscle can create a lot of issues to the lumbar discs. When it becomes hypertonic, meaning increased tension, it can actually pull on the discs, creating disc herniations. Psoas major and iliacus, when we combine them, they come together right here under the inguinal ligament, and they both have the same common insertion, which is on the lesser trochanter of the femur. The iliopsoas, right? You're taking the beginning of the word iliacus and you're taking psoas, we are combining them, calling it the iliopsoas. That's your primary hip flexor. So when your hip, let's say you want to walk up a stair, lifting your hip up in that position is called hip flexion. That's the iliopsoas. So this is the iliacus, this is psoas major. Under the inguinal ligament, they come together. If we were pointing here, it's the iliopsoas, primary hip flexor. If we go back and look at the ASIS, you'll see that there are two muscles. It makes an upside down V, or here to here. These are two separate muscles that both originate on the iliacus. One of them I call the Starbucks muscle. The reason why I call it the Starbucks muscle is because it's called the tensor fasciae latae. So the TFL, tensor fasciae latae. If this shows up on the exam, don't abbreviate. You'd have to write out tensor fasciae latae. It originates on the ASIS, but look where it inserts. I'm going to zoom in. It may be hard to see here because the coloring of the outside and this tendon is the same color, but it's going to insert. And when we take this image and we rotate it a bit, so we're looking at it from the lateral view, we'll be able to see this soft tissue structure, that goes from the top of the ilium and extends down to the tibia right here, called the iliotibial band or the iliotibial tract. The TFL is an abductor. It's a hip abductor, AB. The other muscle that originates on the anterior superior iliac spine, the ASIS, is the longest muscle in the body, which goes in this direction. Right? It kind of spirals. It goes superficial to the quadricep muscles, which are here. It goes around obliquely, comes down on the inside of the knee, and it inserts right here on the inside of the knee, just medial to the tibial tubercle. It inserts on an area called Pes Anserine. Pes Anserine means goose foot because it looks like the shape of a goose's foot, that webbed shaped. When I rotate this thigh and we look at this structure from the medial aspect where all the adductors of the thigh are, we'll get a better look at the Pes Anserine. It's an important area because there are two other muscles that share the same insertion. Not just the Sartorius, but a muscle called the gracilis and a muscle called the semitendinosus. Okay, let's look below these two muscles now. And also, let me go back to the Sartorius for a second. The Sartorius has a few very important actions. I call it the Faber muscle, F-A-B-E-R. F-A-B as in boy, E-R. F is for flexion, A-B is for abduction, and E-R is for external rotation. So the Sartorius muscle flexes the hip, abducts the hip, and ER externally rotates the hip. Okay, when I say hip, again, we could say thigh or femur. That's what the Sartorius muscle does, Faber. It flexes the hip, it abducts the hip, and externally rotates the hip.
Professor?
Yes.
So just to be clear, in other words, when you're saying that it flexes the hip or the thigh, it's as if you're bringing your knee upwards?
It would be like if you're sitting on the chair and you take your right hip, you flex your hip and externally rotate it and abduct it, your leg, your fibula and tibia are now resting on top of your left knee so that your body is in a figure 4 type of position, or also known as the tailor position, as if you were a tailor sewing something. Does that make visual sense as I'm describing it to you?
Not quite.
If you're sitting down, take your right thigh, your femur, flex it up, and now cross your legs. Take your right leg and put it over, and I mean take your right leg, your tibia and fibula, and put it over your left femur.
Okay, so up and then rotating.
Rotating your femur
so that's
externally.
Rotation.
That's rotation of your thigh or your femur.
Okay.
That's the figure 4. Like now your left leg and thigh is fully extended and your right one is bent. It makes like an upside down number 4 from the way you would be seeing it.
Okay.
Okay, so Faber. Now let's look at the quadricep muscles. Quad means 4, but we only see 1, 2, 3 from this view. One of them is called the Rectus Femoris, which is a superficial muscle. It's the only one that crosses 2 joints. It crosses the knee, as all of the quads do, but it also crosses the hip joint up here. And that's because the rectus femoris originates on the AIIS, the anterior inferior iliac spine. And then the rectus femoris comes down, down, down. Here's the quadriceps tendon. It inserts on the patella, and then it crosses over again and attaches to the tibial tubercle or tibial tuberosity. When the rectus femoris contracts, it extends the leg or extends the knee. When it contracts proximally up here, it flexes the hip. So only the rectus femoris, because it crosses the hip and the knee, can act on the hip and the knee. It flexes the hip, extends the knee. The other two on this side and this side, the vastus medialis and vastus lateralis, they don't cross the hip, which means they have no action at the hip, but they do cross the knee joint. So they're all involved in knee extension, AKA leg extension. So that's 1, 2, 3 of the muscles, but they're called quadriceps because there's 4. The fourth is deep to the rectus femoris. We have to peel away, and you can see there's a separation here. We'd have to dissect the rectus femoris, peel it away, and then deep to it, we'll see a muscle called the vastus intermedius. Intermedius because it's between the medialis and lateralis, so it's intermedius, vastus intermedius. When we look down at the lower leg, here's the tibia. So this muscle, tibialis anterior, is named by its location because it's in front of the tibia, tibialis anterior. It's a pretty large muscle. It's a powerful dorsiflexor of the foot. This is the dorsum of the foot. The top of the foot is called the dorsum. So it dorsiflexes, meaning it brings the toes and the ankle upward so that your heels, your calcaneus is planted on the floor and your sole of your foot and your toes are off the floor, but your heel is making contact. That's called dorsiflexion. When you're stepping on your tippy toes, that's called plantar flexion of the ankle, plantar flexion. So tibialis anterior is in front of the tibia, and if we follow it down and we look at its insertion, it inserts here on the inner foot on the first cuneiform and the first metatarsal. And because of this angulation, you can see it kind of goes on the diagonal from here to here. When the tibialis anterior contracts, it doesn't only dorsiflex the foot, but it brings the sole of the foot inward. And we call that inversion of the foot. When you watch my video on me performing the actions, I show inversion and eversion. Just lateral to it, just lateral to tibialis anterior, there's an extensor digitorum longus. Any tendon here that's going to the toes on the top, they're extensors. So when the toes come up to the ceiling, that's extension of the toes. So extensor digitorum longus is just lateral to the tibialis anterior, and the tendons go to toes 2, 3, 4, and 5. Okay. The great toe has its own extensor called extensor Hallucus longus, and it is just adjacent to the extensor digitorum longus. So if we look at extensor digitorum longus, here's the belly of the muscle, here's the tendon, and if I zoom in, we see a little bit of a separation right here and here. There's a little line that separates EDL from EHL. So here is the tendon of extensor Hallucus longus. And if we follow it down, it goes right to the distal end of the great toe. Now, this is not the ideal position to see what's on the posterior part of the leg, but you can see the gastrocnemius and the soleus from the anterior. It's just because it bulges out medially and laterally. So we'll get a closer look of the gastrocs and soleus more from the posterior and maybe even the lateral or medial view. Okay, so let's get out of this one and let's take a look at what happens when we peel away the rectus femoris. When we peel away the rectus femoris, that superficial quadricep, we can see right here it's cut, and now we can see the vastus intermedius. You can still see the vastus lateralis, you can see the vastus medialis. You don't see rectus femoris. We had to cut it in order to see vastus intermedius. Now we can see also a few of the inner thigh muscles. Anything that's on the inside is going to adduct, whereas things that are on the outside will abduct. So we're going to find the adductor longus, magnus, and brevis more on the medial compartment of the inner thigh. The adductor that's most superficial, right near the pubic tubercle up here, is called a pectineus. It's a very, very short muscle and a very strong and powerful adductor or adductor. Let's hone in a little bit on the lower leg that just focuses there. Here's the great toe, so we know that this is medial. Here's the pinky toe, this is lateral. Anything that's on the front has the ability of extending the toes. The foot, we really don't look at the foot as extending or flexing. The foot or the ankle dorsiflexes or plantar flexes. Okay, so the tibialis anterior and extensor digitorum, anything on the front that crosses the ankle will dorsiflex the ankle. Anything on the back of the leg, like the gastrocs and soleus, they'll plantar flex the foot. Since they're antagonistic muscles, meaning they're on opposite sides of the bone, they do opposite actions. So here's the tibialis anterior. It's a large medial muscle. And again, it goes down and inserts on the first cuneiform and first metatarsal. You see this soft tissue structure holding down these extensor tendons? Guess what we would call that? Who wants to chime in and see if you know what this is called? We had one of the wrist. Anyone want to take a guess? It's called the extensor retinaculum because it's holding down the extensor tendons, the extensor retinaculum. And if there's an extensor retinaculum, there's probably going to be a flexor retinaculum as well. Okay, here's the EDL, extensor digitorum longus. Here's the belly of the muscle. Then we watch it come down and it sends extensions to the second, third, fourth, and fifth toe. Here, the extensor hallucus longus is just deep to the EDL. So deep to this muscle is the extensor hallucus longus, the belly of the muscle, but we can see the tendon. Here's the separation between here and here. We see it here, then it comes down, and we can see it go right down here to the great toe. When this one's hypertonic, when there's increased tension, it pulls the toe laterally, right? Because the belly of the muscle is more here, up higher, and then when we follow it down, the tendon moves medially. And when you have this angle of pull that goes from lateral to medial, it pulls the great toe lateral and you get a bunion that forms here. All right, let's go back up now. And now we're going to take the hip and the thigh and the leg, and we're going to rotate it so that we can see the same structures from the lateral view. Anterior, posterior. Let's start up at the top. Here's the lumbar spine. Here's the sacrum. Here's the iliac crest. Here's the ASIS. There's your tensor fasciolata. Now here is that iliotibial tract or the iliotibial band that I was trying to show you from the anterior view. It's called iliotibial because it goes from the iliac crest, comes down all the way, it stabilizes the lateral knee and attaches to the tibia. Iliotibial band or iliotibial tract. What's unique about it is that it has two muscles that insert on it, one on the anterior and one on the posterior. The anterior one is called the tensor fasciolata. It flexes the hip and abducts the hip. And here is the gluteus maximus. Gluteus maximus, if you look at the direction of these fibers, it is a powerful, powerful hip extensor. It extends the hip. This means every time you're sitting and you go to stand up, your hip is starting in the flex position when you're sitting, but as you stand, it extends it. This is your Stair Master muscle. When you climb stairs and you're climbing up, Gluteus Maximus increases in tension and tone. The one that's right here is gluteus medius. That's your primary hip abductor. The primary hip abductor is gluteus medius. If you want to see minimus, we have to peel this away, and we have to cut a square right through medius in order to see minimus, because it's the deepest one. All right, as we move a little distally, now here's the ITB or iliotibial tractor band. When we look anterior to it, we can see the most lateral quad, which is the vastus lateralis, and we can also see the most lateral hamstring. Now, we didn't mention the hamstrings before. We did talk about the 4 quadriceps in the front. The hamstrings on the back, there are 3 of them. One of them is the bicep femoris, which is the lateral one. And then there are 2 more that are more medially oriented. And those are the semi-sisters, semitendinosus and semimembranosus. So there are 3 hamstrings, bicep femoris, bicep because there's 2 heads, a long head and short head. That's the lateral belly right here. And the insertion is right there on the head of the fibula. The other 2 are on the medial side, semitendinosus, semimembranosus. The hamstrings cross the hip and they cross the knee. If it crosses the hip, it has to act on the hip. Since it crosses the hip on the posterior, it extends the hip. So hip extension, that's what it does proximally. At the distal end, at the knee, it flexes the knee or flexes the leg. So what do the hamstrings do? Hip extension, knee flexion. The exact opposite of what the rectus femoris did. The rectus femoris, proximally up here, flex the hip. What do the hamstrings do? Extend the hip. All of the quadriceps extend the knee or extend the leg. All of the hamstrings flex the knee or flex the leg. As we move further distally, we're looking at the lateral leg, but from the lateral view, we can see a little bit of the anterior compartment, and we can see the posterior compartment. On the lateral side of the leg, there are the Peroneus Brothers, Peroneus Longus and Peroneus Brevis. Now, these Peroneus Brothers are sometimes referred to as Fibularis Longus and Fibularis Brevis. They're both acceptable. I learned them as Peroneus, but if you refer to it as Fibularis, it's correct as well. One of them is more superficial, the other is more deep. Peroneus Longus, as we hone in and we zoom in a little bit, Peroneus Longus is the superficial one. Here is the tendon of it. It's right in the center, right in the center. We follow it down, and it goes underneath the foot. It disappears on the lateral side, and it moves to the inner part of the foot, where the medial arch of the foot is. Whereas the Peroneus brevis looks like the feather, we could see the belly on both sides. This is Peroneus brevis, this is Peroneus brevis, and the tendon of that is deeper, and it inserts right here, right on the base of the 5th metatarsal. Okay. Since the Peroneus brothers are lateral, and they attach on the lateral side, especially brevis, it everts the foot. Remember, Tibialis Anterior was a foot or ankle inverter. The Peroneus brothers are foot everters, eversion of the foot, or foot eversion. On the posterior side, we can see 2 muscles, Gastrocnemius and Soleus. The Gastrocnemius has 2 heads, a lateral head and a medial head. Since we're looking at the pinky toe, this is the lateral view, this would be specifically the lateral head of the Gastrocnemius. Deep to it, if we cut this away, you'd be able to see the soleus very, very well. Both the Gastrocnemius and the soleus attach to the calcaneus. That's their insertion on the calcaneus. This tendon is the famous Achilles tendon. The Achilles tendon. Most commonly ruptured tendon in the body is the Achilles tendon. They are ankle plantar flexors. That means stepping on your tippy toes. That's plantar flexion. Okay, now we're going to go a little bit deeper. We're going to go down. We're going to dissect the gluteus maximus away so we can see what's deep in the hip. So here's the iliac crest. Here's the sacrum. And you can see this image is nicely described by the gluteus maximus cut. So it's telling us that here would have been the gluteus maximus, but it's dissected away so we can see all of the glute medius. And then there are 5 of the 6 deep lateral rotators. There are 6 lateral rotators, aka external rotators of the hip. External rotation is when the greater trochanter rotates externally, meaning it moves more posteriorly. When that happens, your toes point outwards, right? Your leg and foot come along for the ride, and when your feet point outward, that is a externally or laterally rotated hip or thigh. There are 6 muscles that do that, and the little silly mnemonic for that would be, please go quietly. Please go quietly. The P in please would be for piriformis. Go. You'll see that the G is for gemellus. The O is for obturator. And the reason why I'm saying it twice, go, is because there's a gemellus superior and a gemellus inferior. There's an O, an obturator internus, and an obturator externus. So please go quietly. The Q is for quadratus femoris. Piriformis is spelled wrong. It's P-I-R-I, P-I-R-I, piriformis. The way you locate the piriformis is you find the yellow nerve. Find the sciatic nerve, go above it, and that's the piriformis. There's a condition that I treat quite commonly called Piriformis Syndrome, and it is when the piriformis muscle is in spasm, it forms a type of sciatica because it hits this nerve, sending shooting pain down the leg. It causes a condition called Piriformis Syndrome. It is a trigger or a type of sciatica. So you got glute medius up here, glute maximus was cut. Piriformis is a hip external rotator, as all of these are. And the one that's the most inferior looks like a quad. It has 4 sides to it, called a quadratus femoris. The reason why I love this view is because when we peel away the gluteus maximus, we can see the origin to the hamstrings. And the origin to the hamstrings is this bone that we're all sitting on right now, called the ischial tuberosity. All of the hamstrings originate on the ischial tuberosity.
Professor, did you say that there were 6
Yep.
lateral muscles?
Good. You were paying attention. I was waiting for someone to ask that. The reason why we only see 5 is because here's the obturator internus. The externus is seen on the other side.
Okay.
Okay.
And that's the other O.
That's the other O. So it's please go quietly. The P is for piriformis. Go, G-O. The G is for gemellus. The O is for obturator. There's 2 G's. There's a gemellus superior and inferior. And then there's 2 O's, obturator internus and externus. Okay, we're still, let's see. Let's stay lateral. Did I do this one? Yeah, let's go back here and take a closer look at the lateral foot again. Okay, So this gives us a really nice close-up view of, since we're looking at here's the calcaneus, here's the fifth metatarsal, this is the lateral malleolus. We can see that both Peroneus brothers, the Peroneus Longus and Peroneus Brevis, go posterior to the lateral malleolus. Brevis attaches here to the head of the fifth metatarsal, whereas longus is called longus because it's a long tendon. It starts up here, it goes down, and then it goes underneath the plantar surface of the foot and attaches to the inside where the first metatarsal is and the first cuneiform. Then we can see the lateral head of the gastrocs and the soleus, both gastrocs and soleus attached to the calcaneus by way of the Achilles tendon. On the anterior compartment, we could see the EDL. Again, if I were to ask the Extensor Digitorum longus or the gastrocs and soleus, you're probably going to see these from either the anterior view or posterior view. All right, let's take a look at the superficial posterior compartment. Here's the lumbar spine. Here is the sacrum. Here's the iliac crest. That's Gluteus Maximus, your primary hip extensor. Here's Gluteus Medius, your primary hip abductor. You could see portion of the Iliotibial Tract. And now we can see the quadriceps. My bad, not the quadriceps, the hamstrings. Quadriceps are anterior compartment. There are 4. Hamstrings are posterior compartment of the thigh, and there are 3. Bicep femoris is lateral, and the semi-sisters are medial. The semi-sisters are semitendinosus and semimembranosus. Now remember the Pes Anserine, the goose foot? We're going to take another look at it, but this is it. We can see it right here. It looks like a duck foot or a goose foot, how it's webbed. And there are 3 muscles that insert here to make up the Pes Anserine. I'll show you when we look at the medial thigh a little bit better. Bicep femoris is the lateral hamstring. As we move more medial, there's the tendinosus and semimembranosus. The one that's more superficial is semitendinosus. And then as we look a little bit deeper to it, we can see the belly on both sides. That is membranosus, semimembranosus. The gracilis is the second longest muscle in the body, second to the sartorius. We can see that that's a medial muscle of the leg. And if we follow this down, let's follow it down. Here's the gracilis, there's the belly. Let's follow the tendon. We see that that's another muscle that makes up the Pes Anserine. We have the semitendinosus, that's 1. We have the gracilis, which is 2. And then we have the sartorius in the front, which is the 3rd muscle that makes up the Pes Anserine. Now let's look at the posterior compartment of the leg. There's the gastrocnemius, generally speaking, but we want full credit. Let's be specific. Since this is the pinky toe, this is the lateral head of the gastrocnemius. Here's the medial head of the gastrocnemius. Now, there must be a reason why we see that we can peel away the medial head, and there is. On another view, we'll see when we peel this away, it'll give us a better view of what we see on both sides of the Achilles tendon, which is the soleus. And then here's a nice view of the Achilles tendon. Here's the Gluteus Maximus. Here's the sacrum. Here's the iliac crest. There's the glute medius. These are your hamstrings. We could see the lateral head, which is the bicep femoris. And then we can see the semi-sisters a little bit better. The more superficial one is the semitendinosus. The one that is just deep to it is the membranosus. Here is the gracilis. Right there's your pubic bone. So it's the most medial inner adductor muscle. We follow it down right there. So here we have semitendinosus, gracilis, and in the front would be the sartorius that all have the same Pes Anserine insertion site. The one that gets sandwiched between the gracilis and the medial hamstrings right here, that's the largest adductor muscle, adductor magnus. It's huge. It's a large, large muscle. Now we're going to look at the lower leg, and in this picture here, this kind of is tricky the way it's labeled, and I want to fix it for you. This arrow should be further to the right? It says here, gastrocnemius, medial head removed. Well, here's the calcaneus. This is the medial malleolus. This is the tibia. This is the first metatarsal, so the great toe is here, which means this is medial. So the medial head that was removed is here. What the arrow is actually pointing to, this is the lateral head of the gastroc. But what this is showing by dissecting away the medial head of the gastrocnemius, we could see the soleus really, really well. It's a large belly right here, here, and here. It is a major ankle plantar flexor. So superficially, it's the gastrocs. Deeper is the soleus. Well, what the heck is this thing right here? What's this that's being sandwiched between the two? This is a muscle that's called the plantaris. The plantaris has a very, very long tendon, and it is a thin muscle. It's a short muscle with a long tendon. It's almost would be equivalent to the palmaris longus of the hand. So soleus, gastroc, plantaris. This muscle right here, which we'll show you in a second, is called the popliteus. It's a very short muscle and its fibers run horizontally, and it's the key that unlocks the knee. I'll show you that in another view. Now we're looking at the medial, everything on the inside. You can see a little bit of psoas major here. Here's the gluteus maximus. You can see a little bit. Here's the pubic bone. There's your gracilis. Now let's take a look at the Pes Anserine, because we can see Sartorius right there. We can see gracilis. So these two come in. And then we can see the semitendinosus. All three of those have the same attachment site right here on the Pes Anserine, which is just medial to the tibial tubercle. Here's your gracilis, there's your adductor magnus. There's your sartorius, that's your inner quad, vastus medialis. What is the adductor magnus and adductor longus and gracilis? They're going to adduct the thigh or adduct the hip, same thing. When we look down on the inner compartment, again, you could see the medial head of the gastroc. You could see a little bit of the soleus. When we peel these away, we're going to see some flexors of the toes go right under the Flexor Retinaculum, just like there was an Extensor Retinaculum on the dorsum of the foot. Right here is a Flexor Retinaculum. Just like the Flexor Retinaculum of the wrist can cause carpal tunnel syndrome, the Flexor Retinaculum of the ankle can cause tarsal tunnel syndrome, because there's a tibial nerve that goes through here that can give you tingling to the toes if it gets compressed by any of these muscles. Let's take a look. Let's dissect these two away, and see if we can see the deeper muscles. So now we're looking at the lower leg. The gastrocnemius and soleus and plantaris were cut away. Here's the calcaneus. Here's the head of the fibula. There's that oblique horizontal muscle, right? The popliteus. What's unique about this is it doesn't really get enough attention, but I call it the key that unlocks the knee. The key that unlocks the knee, because in order for the knee to flex, in order for you to bend your knee and to flex your knee, the tibia has to medially or internally rotate just a tad, just a little bit. When the tibia slightly medially or internally rotates, it unlocks the mechanism of the knee so it can flex. So the popliteus is the key that unlocks the knee. It initiates knee flexion by first unlocking it. Remember, there was a tibialis anterior. Now we have a tibialis posterior, and it's right in between the Flexor Digitorum longus and Flexor Hallucus longus. Yep, the Flexor Hallucus longus is a posterior compartment muscle. It goes right behind, it's a lateral posterior muscle. Watch what it does. It's lateral and posterior, goes behind the medial malleolus, underneath the foot, and here it is. There's the tendon of it, and it goes right to the end of the great toe. And if you look at the angle from lateral to medial, this is another muscle that when it's hypertonic and under stress, pulls the great toe laterally, causing the bunion or the hallux valgus. Okay, here's the Flexor Digitorum. It would be analogous to the Extensor Digitorum longus, but this is on the bottom of the foot and flexes toes 2, 3, 4, and 5. So those are 3 muscles deep to the posterior leg. Let's just see if I missed anything here. We did glute max cut. We did glute medius. There's the sciatic nerve. There's the piriformis. It's spelled properly here. This is the proper spelling, P-I-R-I, piriformis. Then we have the superior gemellus, obturator internus, inferior gemellus. Here is the quadratus femoris. There's your sciatic nerve. Here is the ischial tuberosity, which is where your hamstring muscles originate. And then your bicep femoris will insert right there at the head of the fibula. These are the 2 medial hamstrings, semitendinosus and semimembranosus. Tendinosus more superficial, membranosus deeper to it.
Professor?
Yes.
Did we see the that other of the 6 muscles?
No, you have to look. You can't really see it too well. You would have to. The Obturator Foramen is the landmark. So when you find the Obturator Foramen, one's going to be on one side of it, one's going to be on the other.
Okay.
Can't really see it. They don't show it here.
Okay, there's no images that show that.
Let's take a look. Let me stop this here. And let me take a look if I can find one for you.